So, if you thought that house calls were a thing of the past, house calls are actually becoming a thing of the future. Stay tuned to meet our guest today as we learn about the benefits of house calls. Stay tuned. Good morning and welcome to Scan FYI. I'm happy to have with us today Dr. Leonard, Medical Director for the Visiting Physician Services. Good morning, Dr. Leonard.
Good morning.
So glad to have you with us today. And I failed to say that Andrea has the morning off today, so you'll see Andrea back next week with me. So, Dr. Leonard, tell us a little bit about yourself and about the Visiting Physician Services.
Okay. Well, I am a family doctor who's fellowship trained in geriatrics, and I'm the medical director for Visiting Physician Services, and that is a home-based primary care service. So all we do is make house calls to patients who are considered homebound, most of them elderly, and we cover 8 counties in New Jersey. We have 8 physicians and 32 nurse practitioners and physician assistants who make up our team.
Okay, and what would those 8 counties be, Dr. Leonard?
Okay, so those are Ocean, Monmouth, Middlesex, Essex, Passaic, Bergen, and Union.
Okay, so that's a very large territory. That's wonderful. And when a family member has a need to see a visiting physician, what are some of the things that they need to consider to make that next step to have someone come to their home?
Sure. So, the first thing is that by Medicare criteria, the patient has to be considered homebound. And that means that it requires a significant and taxing effort to leave the home. Meaning that there's probably some kind of a gait issue, an issue with walking. Somebody requires a cane or a walker or additional assistance, getting in and out of a car or accessing a physician's office.
Okay. So
that's really the first thing to keep in mind. And the next is that we provide an ongoing service. So we essentially become the primary care physician for that patient.
Okay.
So that's another thing that they'll need to keep in mind, that they would essentially need to give up their own primary care physician, which I do understand is hard for some patients. They've developed strong relationships, but most doctors do understand, of course, when it's very hard for a patient to get into the office, and oftentimes primary care physicians recommend our service to patients who they think are appropriate for that next step in care.
Is there an opportunity to potentially have a consult before that commitment is made to switch at all?
We do offer that occasionally on a case-by-case basis. That's not the way, things routinely go, but we could certainly offer that on a case-by-case basis.
Okay, that's wonderful. And in-home diagnostics as well, is that a part of the care plan once you are working with the visiting physician services?
Yeah, so we are fortunate to work with a number of outside agencies that enable us to provide in-home laboratory testing for our patients. So, blood tests, urine tests. We can help them have also a number of diagnostic imaging tests in the home, x-rays, EKGs, ultrasounds, echocardiograms, should they be needed, can be done in the home, at the patient's convenience. And additionally, we can help coordinate services with outside nursing agencies for things like skilled nursing, wound care, physical therapy, occupational therapy, speech, social work.
Okay. And the visiting physician services has been around for quite some time.
Yes, we've been around for over 25 years.
Wow.
We started in Monmouth County. And a few years back, joined forces with the VNA Health Group, which enabled us to expand and offer a wider array of services to our patients.
That's wonderful. Yeah, the VNA is a wonderful organization. That's a great team to be paired up with. And womb care, again, very important as we're aging, and so it's nice to have that ability to have that team come to your home as well.
Absolutely.
That's great. And then are your patients then on your standard, every 3 months? I mean, obviously everyone's different. So their routine that they're meeting with the physicians, there's a plan in place.
Yeah, so we like to, we practice patient-centered care. So we tailor our care to the individual patient. Some patients require more visits, and some are fairly stable and just require an occasional check-in. So we really do tailor our care to the individual patient. The doctor always goes out first, the physician, to meet the patient for the first time and learn about their history, their medications, and establish a plan of care. And then everyone is assigned to either a nurse practitioner or a physician assistant who will see them on a regular basis, and it will be the same person. So they will have continuity of care with that clinician. They will get to know them well. Often our patients say that the NPs and PAs are like a part of their family. And so that NP or PA will go out on a regular basis that's predetermined with the patient. If there's something that they're concerned about, they may go back a little bit more frequently. If there's a medication change, they might go back in a few days to check on it and see how the patient is doing. And like I said, if somebody's doing very well, they may not check in quite as often. But the great thing about VPS is we're always just a phone call away. We have somebody on call 24/7 who could always offer medical advice over the phone. So our patients have continuous access to, someone with medical expertise from our group.
That's great. And another advantage to having a physician come to your home is that they're able to assess maybe some of the things that might be going on in your home because they're on site.
Absolutely. That's one of the benefits of house call medicine and making house calls. And I think, physicians and nurse practitioners and PAs like that as well, because we really get the whole picture. Yeah. We're not just meeting somebody who comes to the office in their Sunday best, looking well. We get to see how they live and how they move around. Yes. Their house, oftentimes with great difficulty. Sometimes we learn that a patient essentially lives in a chair and sleeps in a recliner and really has a hard time getting out of it. So it really does give us a lot of information, and it helps us to take more holistic care of our patients. We can address nutritional needs, we can address safety, and a number of other things by going into their home. And it also enables us to meet them where they are. Yes. Both in a figurative and a literal sense, but some of these people are so ill and have become so weak and decompensated that they really wouldn't be able to get out of the house to see a physician if they wanted to. Some of these people are in fairly bad shape, and they might be afraid to go to a hospital or call 911. So we can really come in there, and it's okay if they're not in the best state. Right. And, meet them where they are in that way. Exactly. and help them get to a better place in their care.
Right. That's wonderful. And in terms of insurance coverage, Dr. Leonard?
Yeah, so we accept traditional Medicare and Horizon and Amerigroup plans as well. And we also accept private pay from patients who don't have those insurances.
Okay. And if somebody wanted to get in touch with the VPS, the main office number is 732-571-1000.
That's correct. Okay. And that's the number that they can reach us, at with any concerns whatsoever.
Okay, that's great. And we'll put that in the comments as well. Is there anything else that we didn't cover that obviously is an advantage for someone to take, this into consideration when if it's for themselves or for a loved one?
Well, I think that as, people are living longer there, and by living longer, they have more chronic conditions and illnesses. And I think that most people really do want to, what we call age in place. They
Yes.
want to stay where they are. I have patients who I've seen who are still living in their childhood home, believe it or not. So that place has meaning for them and they want to be there. I have other patients who are living in that first home that they are so proud that they were able to buy when they initially got married and had their first job. Or, some people live in areas or apartments where there's a strong sense of community, and they want to stay there because that really adds to their quality of life. And so, we enable people to be able to do that where they don't have to necessarily go to an assisted living or a nursing home. We can enable them to stay where they are, and, help them have the best possible quality of life in their remaining days.
And feel safe and be happy because that's their home. That's their real home. That's
Exactly.
That's wonderful.
And we often see patients who, there's a loved one who maybe doesn't live so nearby, and is struggling to help them. And we add some additional support for that person, because we can get out there and check in. Oftentimes when I meet new patients, one of the stories that I commonly hear is that loved one was trying, maybe it's an adult child or, someone else who's taken some responsibility. And they say it's too much. It's too much to get them out to the doctor, and the patient will say that also. And so I'll hear stories about how they've had 3 or 4 appointments with their primary care doctor or their cardiologist, and on the day of the appointment, the patient tells them they don't want to go, so they're canceling these appointments, and eventually, they run out of medication, right, because it's so hard for them to get out of the house to see their physicians.
That's excellent point. Very good point to bring up. Yeah.
We can certainly help support those people. And, during these COVID times, we can add some additional safety because people don't have to leave the home.
That's great. That's great. Well, I'm so thankful that you were with us today and you got to share what your services are all about. And again, in the comment section, we will have the contact information for the visiting physician services. And I thank Dr. Leonard for being with us today.
It was my pleasure. Thank you so much for having me.
And if it's important to you, it's important to us. Thank you so much for joining us this morning on Scan FYI. We'll see you next week. Take care. Bye, everybody.